Hello, everyone. I'm Jenny Ravelo, Senior Global Health Reporter for Devex. Thank you so much for joining us today. We all know how COVID 19 has disrupted development programs, health programs, and how COVID has also exacerbated a crisis faced by women and girls globally. Just to give you an example, early this year, the UNFPA estimated that globally, because of COVID, 12 million women have experienced interruptions in contraceptive access, leading to 1.4 million unintended pregnancies. Now, when you combine that with conflict and humanitarian emergencies and cuts to funding for these important programs, the challenges faced by organizations to maintain important SRHR programs are even higher. Today, in this panel, our panelists will be shedding a light on some of these challenges, but also providing us some solutions, practical approaches, and recommendations on how to safeguard sexual and reproductive health and rights in conflict and crisis settings. And I'm pleased to introduce you to our women leaders today, who are real champions of protecting women's sexual and reproductive health rights in different parts of the globe. To our panelists, please turn over your videos once I've mentioned your name. We have with us Sarah Rich. She's the Associate Director of the Sexual and Reproductive Health Program at the Women's Refugee Commission. She leads the organization's work on improving access to reproductive, maternal, newborn, child, and adolescent health and nutrition services in Northeast Nigeria, and co-leads the Interagency Working Group on Reproductive Health in Crisis sub-working groups on supplies and contraception. We also have with us Sanou, Sahel Director for MSI Reproductive Choices. She's been with the organization since 2012, taking on different senior roles, including Senegal's Social Marketing Director, Program Director, and Country Director. Lastly, we have Juliana Laguna Trujillo, a Colombian feminist lawyer and activist, a Women Deliver Young leader, and currently working at the Global Survivors Fund, a multi-stakeholder mechanism endorsed by the UN Secretary General, whose mission is to enhance access to reparations for survivors of conflict-related sexual violence across the globe. Ladies, welcome and thank you so much for being with us today.
Thank you. Great to be here.
Well, before we start, I just want to remind our audience, if you have any questions for our panelists, please send them over in the chat and we'll try to get to as many of them as possible. Okay, so let me start with Sarah. Sarah, can you give us, to start with, just to give us a picture of the situation when it comes to access to SRHR services in conflict and crisis settings globally? And also, you recently wrote about access to contraceptives in crisis settings and called for more funding for local organizations. So can you tell us as well about how important it is to fund local partners to ensure contraceptive services continue in crisis situations? Sarah, you're currently on mute. Sorry.
Thank you. Thank you so much for inviting me to be here today, Jenny. I'm really happy to join this discussion. The Women's Refugee Commission is a research and advocacy organization that works to improve the lives of women, adolescents, and children who are impacted by crises globally. I'm part of the sexual and reproductive health team. Our team has a long history of working through partnerships at the global and at the local level in humanitarian settings, going back to the early 90s in the former Yugoslavia conflict. So we've been working in this area over the past 3 decades, and we've long known 2 things. The first is that sexual and reproductive health services and rights save people's lives. So for example, they prevent mothers and newborns from dying in childbirth. So when those services are not available, you have more mothers who lose a child, and you also have more children who grow up without their mothers. And second, we also know that there is a need for these services everywhere in the world, no matter where you live, and that includes conflict settings. I think that everyone can imagine that if your life were suddenly turned upside down, you're fleeing conflict, gender-based violence is on the rise, you might not feel that it's the right time for you or for your family to have a pregnancy, or if you were a pregnant person, you would want to make sure you had somewhere you could go where you could safely deliver your child. And as gender-based violence does increase in these settings, that includes sexual violence against women and girls, and that can also result in unintended pregnancies. So we have all this data. We've known this for a long time. There's not only a need for sexual and reproductive health services and rights in humanitarian settings, but there's also a demand for them. So why do we still have gaps then in these services in crisis settings? We still often see that the people who are in charge of funding and designing services continue to deprioritize women's and girls' health needs or fail to understand them entirely. Sexual and reproductive health and rights are still seen as a political issue, not as the essential life or death health issues that they really are. And as you've said, this has really been amplified during the COVID-19 pandemic as governments and other decision makers have been in a position to decide which health services they think are life-saving and should be continued to be provided and which ones can be paused. We also need to adjust the way we go about providing these services to make it more inclusive and more sustainable. We know that when emergencies strike, the first people who are on the ground providing relief and providing health services are local communities, local governments, local organizations, not the international humanitarian sector. So it's essential that we provide funding to those organizations who will be there when a crisis erupts and who will stay there after a crisis subsides. And it's actually more effective to provide funding to these local actors who really know their own contexts and can provide services to their own communities. We see that supporting local women's organizations can actually expand the reach of programs because women may be more comfortable talking to other women, particularly when it comes to sensitive issues like sexual and reproductive health and rights. As I mentioned in the op-ed that I wrote that you just referenced, the humanitarian sector still has a long way to go toward localizing aid, but we are starting to see some progress, some movement in that direction, and some models emerging that pave the path for how we can do it. At the Women's Refugee Commission, we've been working toward localizing aid for some time now. And most recently, in my work in Northeast Nigeria, which has been affected by armed conflict for more than 12 years, we're partnering with the state level government in Borno State and with local organizations to implement a community health program. But what's really unique about this project is the approach we've taken to implementing it. The Women's Refugee Commission is not in the role of directly providing any health services. Instead, the government of Borno State is taking on that role. And this is really a new way of working for the humanitarian sector, with the international NGO in more of a behind the scenes role, providing coordination, providing support to the local actors to take the lead. Like with any new way of working, any new project model, we've seen some successes, we've seen some challenges, and we definitely have some lessons learned that we hope we can apply moving forward. So with this project, we had quite a long time frame. It was a 4-year time frame, and we had a lot of flexibility. And together, this allowed us to identify and bring on board local actors, including women's-led, community-based organizations. And it also gave us the time and flexibility to really co-design and co-develop what the program would look like in partnership with the local government and local organizations. It takes longer to do this kind of co-design and co-development than just plopping in an international model, but it means that the program is more contextualized and more locally resonant. Even as we're taking this step towards localization, we really know that there's still more that we can do. So given where we're at, how do we as the humanitarian sector do more to make sure that women and girls in conflict settings have continuous access to sexual and reproductive health services and rights? First of all, we need to continue advocating for the inclusion of sexual and reproductive health and rights in funding, in guidance, in training, and in policies from the global to the local level. As we see some governments making cuts, like the UK government recently did, We need other donors to step in and to stand up for women and girls. And second, we need to learn from and expand funding to local organizations. This means major shifts in the way that donors and the international organizations function. And I know we're at a moment where international NGOs are questioning what should this look like and what should their role be in it. I do think there's a role for international organizations on an ongoing basis, but it involves taking some steps back and being in a supporting position rather than a front and center role. Thank you so much, Jenny.
Thank you so much, Sarah, and for giving us an overview of the situation globally, but also the work you're doing in Northeast Nigeria. I'm gonna come back to you on some of the points that you mentioned, but I'm gonna turn over to Sanou. Can you tell us about the situation of women and girls in the Sahel who are facing increasing levels of insecurity, but also are losing their homes because of climate change? How is your organization? How do you ensure they have, access to modern contraception?
Thank you, Jenny. Good afternoon, good morning, everyone. I'm Sanou Gning, I'm the Sahel Director for MSI Reproductive Choices. I'm based in Dakar, in Senegal, and I'm very happy and honored to be on this panel to discuss how we can safeguard sexual and reproductive health and rights in our settings, in conflict and crisis settings. So first of all, I just want to say that I echo so much what Sarah just shared with us. In our Sahel country programs, meaning in Burkina Faso, in the Sahel, in Burkina Faso, Mali, Niger, in Senegal, many of the women and girls who we serve, they are facing increasing level of insecurity. Not only is conflict driving escalating levels of violence and abuse, but many are also seeing their homes, as you said, and their livelihoods decimated by the climate crisis. And this is among other crucial challenges that we have in the region. Let me just tell you a little story that for me highlights why SRHR, sexual and reproductive health and rights, is so needed in a humanitarian context. In Senegal, where I lived, we are at the extreme west of Africa. So we have around 3/4 of the coastline, which is at risk of coastal erosion, forcing many women and their families to migrate inland, or as you all certainly witnessed, some of the community members risking their lives attempting to reach Europe in makeshift boats. So in the coastal town of Saint-Louis is in the north of Senegal, once a bustling fishing community. My team, one of our team in the field, met a fisherwoman who I shall call Fatou. So the sea has swept away her home and her only source of income, forcing her and her family, her children, to relocate to a kind of makeshift camp with 200 other families. And when she met our team, Fatou chose to be fitted with a contraceptive implant, as this is what we are doing at MSI Reproductive Choices. And this has allowed her to choose if or when she wants more children, and at a time when her family faced homelessness, she has been able to get her life back on track. And sadly, these are situations that play out again and again across the Sahel, a region which is also on the front line of the climate crisis. And for many of the women MSI serves here, the climate crisis isn't just something they read about in the news or they heard in the news. It is something they experience every day. And what my teams are hearing from a lot of women living in these vulnerable areas is that getting pregnant, as Sarah said, during a crisis is the last thing they want. Because when disaster strikes, giving women the choice and means to avoid unwanted pregnancies helps them get back on their feet and better support the families they have. In Burkina Faso, another example, we have worsening insecurity, and this has sparked an unprecedented internal displacement crisis, as we all see, uprooting more than 1 million people from their homes since 2019. And there, our teams, our frontline teams, our outreach teams, our MSI ladies, they provide essential reproductive health services to women and girls who have been forced into internally displaced persons camps. And in these crisis situations, as I said, women and girls face a higher risk of abuse and exploitation, all situations that increase their risk of becoming pregnant against their will. And what we are hearing loud and clear is that they want the autonomy in those situations to decide if or when they become pregnant. And there are ways, there are means, solutions to address that. In the Sahel, we all see that modern contraception use is still low across the region, especially the more effective long-acting methods. So our teams are doing everything they can to give those women the reproductive choice that they tell us they want. Our teams are often trekking or driving for days to reach people living in remote rural communities or in those internally displaced person camps. And they offer the widest range of contraceptive methods they can and talk through all the options so that each woman can choose the one that best suits her situation and her plans for the future. We are really adapting our service delivery channels so we can ensure we can reach all those IDPs communities and all those women and adolescents living in camps. And these are women who have often been through traumatic experiences. And we need to slowly win their trust. So we have found that our network of MSI ladies, for instance, who are individual midwife or nurse from the local community, it's a channel which is really flexible and discreet to bring services into these settings. Trusted within their communities, they carry all their equipment with them and can deliver high quality SRH services anywhere. As long as there is a space with a closed door, it's enough. And we also try to make connections with other organizations that provide psychological support or work to prevent gender-based violence in the field. And our teams in Burkina Faso or in Mali work in close collaboration with other organizations, whether local or international organization. For instance, with UNFPA local office and Abbas International in Burkina Faso. For the gender-based violence training, the management of victims, or to give the first line of medical care in case of rape, for instance. And they are also collaborating with organizations to refer those adolescents in those internally displaced person camps to our service delivery point. So this is globally what I can say for this first question. And yes, over to you, Jenny. Thank you.
Thank you so much, Sanu. You mentioned about partnering with others, and that's very important because one organization can't do all of these things, but it's good to hear this women can have access to these contraceptions at a very um, stressful time I can imagine for a lot of them. I'm gonna come back to you because I know Sarah earlier talked about aid cuts. So I'm gonna get back to you on that. But let me just turn over to Juliana. Um, Juliana, can you tell us about the situation in Colombia, which has experienced decades of armed conflict? How things have changed for women and girls, or have they changed since the signing of the peace agreement? What can be done to strengthen access to comprehensive sexual and reproductive health services and care for victims of conflict?
And thank you so much for inviting me to this conversation and to share this space with my colleagues on this super important issue. So reproductive violence is a practice that has been widespread in the context of the armed conflict in Colombia. And this is, as we saw with what Sarah and Sanu said, is not is a thing that we see occurring in context of humanitarian crisis and armed conflict where human rights violations are occurring. So in Colombia, women, girls, and LGBTQI persons in the context of the more than 50 years of armed conflict and ongoing armed conflict face the risk of suffering reproductive violence by armed actors, which we understand that entails all the practices and all the acts that either directly or indirectly affect the right to reproductive autonomy. And in Colombia, these practices have included, but are not limited, for example, to practices of forced contraception and forced abortions as a policy within the ranks of armed groups, or forced pregnancies and forced motherhoods as a consequence of conflict-related sexual violence exercised by armed groups. And we also see it when there is a lack of access to emergency contraception and lack of access to reproductive health services, including safe abortions for victims of conflict-related rape, among other practices and acts. And this situation has been going on throughout the armed conflict in Colombia, exercised by all armed actors, including paramilitaries, state actors, and guerrilla actors. And what you mentioned, what you asked me about what has happened since the signature of the peace agreement in 2016 between the national government of Colombia and the former FARC guerrilla is that we find that women, girls, and LGBTQI persons are still at risk of suffering reproductive violence. So after the signature of the agreement, more than 70% of the country's departments have municipalities that are on alert because of illegal child recruitment. So young women, young girls are at risk of joining or being illegally recruited by armed actors who have not laid arms or who have taken arms in this new context of ongoing confrontation and face the risk of suffering sexual and reproductive violence within these groups. But additionally to that, with the worsening of the armed confrontation in some parts of the country, women and girls again find themselves at risk of suffering conflict-related sexual violence and reproductive violence and not having adequate and prompt access to sexual and reproductive health services. And this whole situation has worsened in the context of the COVID-19 pandemic, where access to reproductive healthcare services, which include abortion, was not considered essential. It has worsened, for example, because schools closed for a long time. So children were not going to school and were facing this risk of being recruited by armed actors and suffering these possible outcomes of gender-based violence, affecting their right to decide on whether they wanted or not to have children and exercise motherhoods in this context. And I have worked more from a legal standpoint, and I have litigated cases at the national level in Colombia and before human rights bodies in the inter-American system. And these practices of reproductive violence have been put into the knowledge of different authorities of the Colombian state, and also of before the mechanisms that were created by the peace agreement that are key in this context, in which not only women have experienced this kind of violence, but also continue to suffer the lingering impacts of it. So it is key that today the work that the Truth Commission, for example, is doing in Colombia with the documentation and investigation of what happened during the armed conflict, and doing recommendations specifically of what happened to women is key to guarantee non-recurrence of these practices. The work of the Special Jurisdiction for Peace in granting advancing and guaranteeing and protecting the right to justice for victims is key also in this context. But furthermore, institutions like the Unit of Victims in Colombia that provide reparations for victims of the armed conflict is also essential to address the impacts of sexual and reproductive violence in this context. So I would like in the point that you bring, Jenny, on what are the practical recommendations and a little bit taking into account what Sarah and Sanou have said, it is essential that the state ensures the availability of and access of comprehensive sexual and reproductive health services and care for victims in all national territory, but especially in the most conflict-affected areas, just to begin with.
Thank you so much, Juliana. And you just mentioned, we talked about donors and aid, but also just how very important the role of national governments is in, preventing these types of violence and making sure there's access to SRHR programs, in different parts of the country. I want to turn to, I know we have 5 minutes, but I want to turn to a bit of some of our panelists very quickly. Sarah, you mentioned about the work you're doing, localizing aid in Northeast Nigeria. And I know you said you have some lessons learned. I know we can't talk about all of that, but perhaps you can give us one or two lessons and how can this be done more effectively? Perhaps for, some of our audiences who are trying to do the same. You're on mute, Sarah?
Sorry. Happy to chat about that. Sorry. Thank you, Jenny. So the first thing that I'd like to note is the way that the funding flowed to us from the donor made a huge difference. So as I mentioned in my remarks, we had a long time period for this grant, 4 years, and we had quite a bit of flexibility to be able to design and develop the program after the grant came through. And that really allowed us to be able to work closely with local partners on even kind of figuring out the details of what our program would look like. We also really aimed to create an equitable partnership with all of the consortium partners on this project. So we had really transparent decision-making processes in which decision-making power was spread out across the different actors rather than consolidated just at one organization. I think those are some of kind of the key takeaways that we would like to continue moving forward with and that we hope will inform the field moving forward.
Sanou, you talked about, there was talk about earlier about funding, and I know that the UK aid cuts that was announced, just this year is really having an impact on a lot of SRHR programs. Can you tell us how you're navigating, how you're planning ahead, or perhaps to overcome, those cuts?
Yeah. So UK funding through the UK's flagship Women's Integrated Sexual Health, the WISH program, it was really a game changer for us in the Sahel because it enabled us to serve more than 270,000 people every year in the region. And over the last 3 years, it really helps us avert over 1.1 million unintended pregnancies, to avoid unsafe abortion at a larger scale, to also make savings around 47 million GBP in direct healthcare costs, and to avoid maternal deaths also. However, since the cuts, the money we receive from the UK has been vastly reduced, meaning fewer teams and fewer services delivered. If we take at the global level, UK AIDS cuts left MSI facing around 45 million GBP funding gap, an even greater loss than when former US President Donald Trump reinstated and expanded the Mexico City policy. So we have been fortunate that other donors that are committed to sexual and reproductive rights are stepping forward to keep things going in the short term. However, we are still facing gaps in the Sahel, leaving services at risk of closure, including several essential outreach teams, around 5, I think, more than 10 MSI ladies, some essential activities around youth SRHR in countries, in the Sahel countries that we certainly expect to close by the end of this quarter or the end of this year. So the UK had been a leader in sexual and reproductive health and rights for many years, and these cuts have left a large hole to fill. We are worried that where the UK leads, others may follow. However, we are staying optimistic. We have survived a challenging time with the previous US administration, and we are now starting to rebuild our relationships with USAID. And these things take time, but they give us hope. They give us really hopes. And the last thing I just want to say, as I know that we are running out of time, is that funding for global health is really shrinking right now, and demand for SRHR is increasing. And a simple, cost-effective solution for us is for donors to adapt climate funding mechanism to broaden the scope and allocate adequate resources to SRH programming. We must invest in SRHR healthcare as part of the response and ensure that women's voice are at the heart of the conversation, because it's a grave injustice. It's unfair that those overwhelmingly affected by the climate crisis are those that have contributed the least. And it's vital that we listen to what they are telling us. Thank you, Jenny.
Thank you so much, Sanou. That's a really interesting, proposal. We don't have much time, but I wanted to just turn very, very briefly to each of you. Juliana, I'll start with Juliana. Do you have any call to action to governments, to donors who may be watching or could watch this later on?
Highlight again the obligation that states must uphold to ensure availability of and access to sexual and reproductive health services as essential services in context of conflict and crisis, while guaranteeing the rights of truth, justice, and reparation, and non-repetition for victims of reproductive violence. Thank you so much, Jenny.
Thank you, Juliana. Any last call to actions from our two panelists?
I would just echo Juliana's.
And it's okay for me also. I echo Juliana and Sarah.
Well, thank you so much, everyone. I've learned a lot from you. There's several things I wanted to follow up, but I know I don't have much time. And for those who sent question, I don't know if there's a chance for us to reach out to you, but we'll try to get your questions to our panelists, and we'll see if we can get them to you. Thank you so much again to our women leaders and also to our audience for tuning in. Please stay tuned because we have more events coming.